Good morning and welcome to our Community Health In-Service. My name is Kimberley and I'm a third year nursing student with JCU. I've been asked to attend today to introduce you to continuous glucose monitoring, a new form of technology advancing the way in which patients with type 1 diabetes self-manage their condition. In today's session, we will have a look at the prevalence of type 1 diabetes within Australia and introduce you to continuous glucose monitoring. We will also explore the benefits, challenges and opportunities this new technology may bring to both nurses and the patient user. Hopefully, by the end of today's session, you will have a brief understanding of the continuous glucose monitoring systems and how to use the products available within Australia. Type 1 diabetes is a chronic condition caused by an autoimmune response, leaving beta cells of the pancreas damaged and unable to produce sufficient amounts of insulin, or in some cases, no insulin at all. Insulin is a hormone that plays a critical role in regulating the body's blood glucose levels and facilitating cellular uptake of glucose to be metabolized for energy. Without sufficient insulin production, blood glucose levels and HbA1c levels remain elevated and if left unmanaged can lead to serious, sometimes life-threatening complications. Tight glycemic control is required to minimize the risk of long-term hyperglycemia and to avoid complications associated with insulin therapy. There is a wide variety of strong evidence from numerous studies supporting the use of continuous glucose monitoring, or CGM, to reduce both HbA1c levels and glycemic variabilities. While the onset of type 1 diabetes can occur at any age, it is most commonly diagnosed before the age of 14. Statistics indicate 60% of people diagnosed with type 1 diabetes receive their diagnosis before the age of 25. In 2016, an additional 2,625 Australians were diagnosed with type 1 diabetes, ranking our country to be the 6th highest in the world for incidence of the chronic disease. While there is no cure for the condition, several management strategies exist, with advancements being made every year to improve the quality of life for those living with type 1 diabetes. Life can often feel like a game of numbers for those living with diabetes. The ongoing process of balancing meals, insulin injections and exercise in an effort to maintain blood glucose levels within a safe range can sometimes feel like an onerous task. Up until recently, the most accessible way for young Australians living with type 1 diabetes to assess their blood glucose levels and response to insulin therapy was to self-monitor using the finger prick test of capillary blood. This method, however, provides only a snapshot reading of a single moment in time and fails to provide valuable information such as fluctuations and patterns in blood glucose levels. Other challenges presented by finger prick self-monitoring, such as pain, inconvenience, and perceived pointlessness, can lead to infrequent use and development of adverse complications resulting from insulin therapy, such as hypoglycemia. Continuous glucose monitoring, or CGM, was first explored in the late 1960s as a way to gain insight toward the trends, patterns, and fluctuations of blood glucose levels. Since making its world debut into practice in the early 2000s, the use of CGM technology has gained increasing interest due to its ability to improve glycemic control for those living with insulin-dependent diabetes. The cost of CGM products, however, remains high, making them somewhat unobtainable to the general population of people living with type 1 diabetes. In 2017, the Australian government announced significant funding had been allocated to introduce a fully subsidised scheme providing CGM products to eligible Australians aged between 2 and 21. CGM technology has evolved rapidly over recent years, with substantial improvements having been made to product wearability and patient comfort, accuracy of information, and device capabilities. CGM technology gives its users the ability to monitor glucose levels using a sensor, transmitter, and handheld device. The sensor is inserted subcutaneously under the skin. This can be done by a healthcare professional or by the user themselves and can remain in place for up to 10 days, depending on the device. The sensor measures the glucose level in the interstitial fluid and is linked to a transmitter, which then sends this information wirelessly to a monitor, such as a smartphone. Unlike other glucose monitoring devices, CGM systems monitor the glucose levels continuously and remain independent of any action being required to initiate the reading. The data sent from the CGM can be used in real time to assist patients to self-determine the action required to maintain glycemic control, or retrospectively by practitioners to assist in formatting strategies to control glucose levels both throughout the day and overnight. Features such as alarm capability alert the user to impending hypoglycemia and allow for early action to be taken to prevent any acute complications. While the concept of CGM remains the same, there are some variations in systems and their ability to integrate with supporting technologies such as automatic insulin pumps. Some devices have the ability through integration to initiate or suspend insulin delivery by the automated pump, thus further avoiding any hypoglycemic events. A number of studies have taken place to explore the overarching benefits of CGM. CGM has been proven to avert hospitalizations and reduce the number of incidences of hypoglycemic events and diabetic ketoacidosis. There is also evidence supporting CGM in decreasing the long-term complications of poorly controlled glucose levels through improving self-management ability of glycemic control. While there are many benefits associated with adopting CGM into community health practice, these systems do not come without their challenges. As the sensor is positioned subcutaneously, it measures the glucose levels of interstitial fluid rather than blood. There is a physiological delay of glucose to shift from vascular space to interstitial space. This process can take approximately 5 to 10 minutes and has raised concerns in the past within the medical community that rapid changes in circulating glucose could lead to significant differences in measurements. Accuracy of glucose levels detected also decrease with abnormally high or low readings. In the circumstance of high or low readings, manufacturers have recommended the patient assess capillary blood glucose level and take action based on this reading. Past models of CGM devices have also required the user to calibrate the system twice a day. With advancements in CGM technology, newer, more advanced models have been able to overcome these challenges, advancing the accuracy of interstitial readings in relation to blood glucose readings, making the devices more reliable and user-friendly. The introduction of any new technology into practice requires an investment of time, energy, effort, judgment, and initiative by both nurses and healthcare teams alike. Coupled with the day-to-day demands of nursing in the community health sector, and an understanding of the challenges any new technology brings, an emphasis needs to be placed on obtaining the resources required to adequately teach health professionals how to use and interpret CGM. This then enables us as nurses to empower our patients and support them through self-management of their condition. Emphasis must also be placed on nurses' communication skills to both enhance the therapeutic nurse-patient relationship and clearly deliver meaningful education to the patient. Patient education should be focused on the mechanics of insertion and removal of sensors, use of the transmitter, receiver, and auxiliary devices such as smartphones, computer, and software, and should address contingency planning in the event of device malfunction. Through advanced communication skills and in-depth knowledge of disease process and a clear understanding of CGM technology, including both challenges and benefits of use, nurses are able to empower their patients to become confident in their ability to translate information from their CGM into appropriate actions to manage their condition, maintain optimal glycemic control, and improve the quality of daily living. Through advanced communication skills and in-depth knowledge